Are you grappling with gastrointestinal issues after taking your diabetes medication? Ever wondered about effective strategies to navigate and manage these effects? Well, fret not. You're in the capable hands of a professional guide, ready to unveil the comprehensive array of both pharmacological and non-pharmacological approaches. Let's embark on this journey together towards a smoother, more comfortable diabetes management experience. Pharmacological options. Slow titration. Commence treatment with a low dose of medications like metformin. This allows your body to gradually adapt to the drug. Follow the healthcare provider's prescribed titration schedule to slowly increase the dose over weeks. Monitor for any signs of gastrointestinal discomfort and communicate them during follow-up visits. Switching medications. Discuss your experience with current medications, such as sulfonylureas or meglitinides, especially if gastrointestinal issues persist. Explore alternatives like DPP-4 inhibitors, e.g., sitagliptin, or GLP-1 receptor agonists, e.g., liraglutide, known for their milder gastrointestinal profiles. Understand the transition plan, including the cross-titration process and any dosage adjustments. Combination therapy. Consider combination therapy with drugs like metformin and a SGLT2 inhibitor, e.g., empagliflozin, or a DPP-4 inhibitor. Lower individual doses of each medication can often minimize gastrointestinal side effects. Adhere strictly to the prescribed regimen and report any unusual reactions. Extended-release formulations. Inquire about extended-release formulations of medications such as metformin ER, extended release. Understand the sustained-release mechanism, ensuring consistent drug levels over time. Report any adverse effects or unexpected symptoms to your healthcare provider. Antiemetic medications. If experiencing nausea or vomiting, consult your healthcare provider about the addition of antiemetic drugs like ondansetron. Use antiemetics as prescribed, particularly during the initial phase of medication adjustment. Report any adverse reactions promptly. Non-pharmacological options. Dietary modifications. Collaborate with a registered dietitian to tailor a diet plan that aligns with your medication regimen. Focus on low-fat, easily digestible foods to mitigate gastrointestinal distress. Keep a detailed food diary to track responses to different meals and discuss it during appointments. Meal timing. Take medications like metformin with meals to enhance tolerability. Maintain a consistent meal schedule to optimize drug absorption and glycemic control. Report any deviations from the routine during follow-up appointments. Lifestyle changes. Engage in regular physical activity, incorporating both aerobic and resistance exercises. Choose activities such as brisk walking or cycling, ensuring at least 150 minutes of moderate-intensity exercise per week. Report any challenges or concerns related to exercise promptly. Hydration. Ensure adequate hydration by consuming at least 8 glasses, 64 ounces, of water daily. Carry a water bottle for easy access and encouragement. Report any signs of dehydration, such as dizziness or dry mouth. Patient education. Actively engage in understanding medications like metformin, sulfonylureas, and newer agents such as DPP-4 inhibitors. Utilize reputable resources to enhance your knowledge of diabetes management. Pose questions during appointments to clarify any uncertainties. Monitoring and communication. Keep a meticulous record of blood sugar levels, noting patterns and trends. Attend regular follow-up appointments to discuss progress and adjust treatment plans. Maintain open communication with your healthcare provider, reporting any concerns promptly. Remember, always consult with healthcare providers for personalized advice and adjustments. Thanks for watching.